Let's see, as far as starting therapy with Ozzy, it's been really about 2 years. But that's when it got more like serious when for some serious competitions, such as this one coming up in 2 months in Finland. It's Abu Dhabi, the 80cc Abu Dhabi Combat Club. It's every 2 years. It's the hardest submission grappling competition in the world. I've won it 3 times. I took silver 1 time. So it's my sport. It's what I do. I also fought before in the UFC Ultimate Fighting Championship. I was top 3, 4, 5 ranked in my division, 185 pound. Yeah, I used to be 185. I used to be 10 years ago or so. I also fought at Pride FC in Japan. So I've been around the combat sports for about 25 years of my life, and over time, things happen. It's just the way it is, you know. I've had surgeries. There's typical injuries. There's atypical injuries. There's things that happen in life, and of course, you know, as you get older, you learn that you should. You know, you're not young anymore, and you learn from your mistakes, and you try to take care of your body. That's why we wore Ozzy. That's why.
So first of all, the most important part is understanding the disciplinary movements of that sport. You know, me having a athletic background, being an athletic coach about 10, 12 years in a row, it helped me a lot to progress. Me being a really successful therapist. Mm-hmm. So, you know, I'm also a big fan of Dean, and I've been watching him since I was young. When I first came to San Diego, I was a young kid. I went to City Boxing Club. Remember those days? Yeah. So, I've been watching all of his fights when he was fighting at Pride, UFC. I watched him pretty much since I was a first day in the United States. What helps me to help my clients like Dean understanding their game. I'm not obviously black belt in jiu-jitsu, but I'm a big fan, and I understand what kind of movements they use, you know. And then if they have a top game, bottom game, which muscles they use most. If they like Eddie Bravo likes to be on his bottom most of the time, so I understand what kind of techniques what kind of moves they use most. And then from there, you know, I try to educate my athletes first of all how to counteract training the structures that they use most. And also I try to make sure that the range of motion, mobility, and the stability is going to be always there for them to perform what they want to do, you know, high level. So in this case, he's a high level jiu-jitsu practitioner and competitor. I try to make sure that his tendons always have the blood flow in a range, high range of motion angles, like he's going to be still having some sort of resistance there without getting injured. I try to make sure that his hips always have the mobility on both directions, internal and external. I try to make sure that his upper body in the front is not dominating too much, which is usually the case. So if something goes different way, in a back way or something, he will be able to resist. And I also try to make sure that knees and the IT bands and the important structures that keeps him going on, I try to make sure that every part of the structure is getting a blood flow, nerves are doing their job, and every muscle is doing their own job. And they're pretty much, we have about 610 muscles on our body, about 204 bones. So human is a very complicated machine, pretty much. And this is one of the machines here we're working with, pretty much.
Well, there's so many benefits, but at my age, I'm one of the older athletes now, specifically is recovery, because, well, I don't know why, like, to this day I'm stronger than I ever was, you know, even before when I was younger, but probably, you know, energy, recovery, flexibility, these kind of things. You know, when you're young, you know, you could actually not even eat perfectly correctly, and it doesn't really matter, actually, you know. I don't want to sound like a bad influence, but I mean, when I was young, I could have got drunk and trained the next day, no problem. But now I'm older, and I'm starting to see that I'm not 21, 22 anymore. And so now, you know, these kind of things, of course, you make different decisions when you get older. And, you know, so I think it comes into play more when you get older and you're more aware of your body. Yeah. And so mostly recovery and to maybe avoid injuries. You know, I have small injuries right now, but we're trying to make sure they don't become a major injury, because we both had bicep surgery. Yeah, the same doctor actually.
Yeah, we both have a bicep surgery.
Bicep, yeah, snapped. It was just a freak accident training and boxing actually, and I don't know, just minimize the injuries. And you know, so many athletes have their career ruined by some extreme injury that could have been prevented. Of course, there's some things that are just crazy accidents that you know you can never see, but a lot of things can be prevented. And so I think that's the main reason. But besides that, recovery. So
injury prevention and increase athletic performance. I would say
performance, but also so I can recover, so I can train harder, and then even have more performance. So that's, I guess, in a nutshell. Yeah, exactly. Those three reasons. I'm 11, you know, I was 35, and so it's weird for me to have been considered like the best in the world in 2003, and then again 8 years later. That doesn't happen too often. I'm not saying anything good about myself specifically. I'm just saying that I've always had an open mind, and I've always been open to learning new things, and not staying as like the dinosaur. You know, I wanted to always learn new things and try to be innovative, and some things that make sense to myself. You know, I have to trust that, you know, that feeling I have, and if you can identify those feelings and they make sense to you, and you follow those things, you know, your ideas or things you believe in, you know, it really can help you out a lot in the long run, in my opinion. Well, it's typical, I guess, maybe rightfully so, criticism of Western medicine, which of course is very high level and is necessary. I mean, my bicep snapped, and I needed the surgery, but the prevention, you know, of these kind of things, such as Western society, it's almost like everything's instant gratification. You know, fast food. Here, you go to McDonald's. Well, I don't eat McDonald's anymore. Not for a long time, but you have it right now. And you know, in other countries, I think it's really strange. You know, people actually make their own dinner. You know, and it's actually much healthier and much better if you think about it. So I'm just saying that Western society, as much as I love things about, of course, I'm from Western society myself, but I've been in 44 countries. I speak several languages. I consider myself a person of the world, and.
But in other countries, they don't have a soft tissue treatments yet. Most of them. It was developed in the United States about 30 years ago, soft tissue manipulation treatments, and it's fairly new in the United States. It's just barely going to Europe, maybe one or two countries. I was going to be one of the guys who's going to take it to Turkey, but it's too much work at the moment. I just enjoy working on my athletes. So that will probably answer the question a little bit too, because if you compare with other therapists in other countries, other athletes, they don't really have a upper level soft tissue treatments. Most of the time, physical therapy, chiropractor, maybe not even that much, because it's a little bit well known in the United States. That will probably answer the question a little bit too, you know.
Yeah.
Important. So, what I try to do, what makes me a little bit different, I think, from the rest of the soft tissue treatment therapists in San Diego or in the United States, what I try to combine is Eastern's mind, energy, combined with Western's highest level application. So, in my personal opinion, through my experiences, I've been an athlete. I had a spinal surgery, you know, squeezing my throat and stuff. So, what I find over the years, the best Western application is soft tissue treatment, but it's really hard to apply to some of the Americans, because we have too much anxiety, stress, you know, neurological system the brain is tight, you know. So in some case of the athletes, you know, if they have injuries and stuff like that, I try to help them out, first of all, how to release the stress in their head, so it's going to affect their body. So I always say 50% mind, 50% psychological, 50% physical. You know, so that's what makes me a little bit different. Today I had a client earlier here. He was locked up. First of all, I tried to relax him in his mind by talking him, and then from there his body started responding to me. So that's why I see myself a little bit different. I have a little bit different application than just the usual Western soft tissue treatment. I'm doing a little bit more than that, because I'm using a little bit Eastern mind, positive energy work, mind energy work, and combined with the Western soft tissue treatment, and also my background, all these athleticism years and being athletic coach, and my injuries, everything added up, and I created who I am right now.
I wasn't trying to knock Western medicine because, of course, there's great.
Yeah, of course.
Like surgeries I've needed, of course.
Yeah.
But I'm saying that it seems to focus on the extreme. Once something's broken, how to fix it. Well, it's just nothing to try to make me look like I'm tough or something like that at all. But being fighting for the Ultimate Fighting Championship or Pride in Japan, Pride FC, full contact. I mean, we're getting like shins to our head, getting kicked in our head. We're getting our arms, can be broken. We're falling on, anything you can imagine that's it's a violent act without a weapon to another human being was legal. I mean, you can be slammed on. I mean, you fall, right? Things break. You do get head trauma, and all these things they come together where I think over time you build a higher pain tolerance than the average person. The average person, right? Some people are born with high pain tolerance, but I think you get some.
The sensor, but also he probably build up his tolerance to pain. But I'm gonna be honest with you, half of my clients probably they're some sort of a professional fighters. Dean's pain tolerance is definitely above the average of the other fighters as well, which makes my job easy a little bit, That's very important. So just like he said, older we get, like we tend to pay attention to details more because we kind of have to. If younger we are, we can get over with the things. Of course, I try to help my athletes how to correctly they over the time with the injuries and everything, they develop incorrect movements, which means they use a wrong structure for wrong job. So I try to readdress that and educate them. Don't do like that. Use this muscle, do this training, and education is the most important thing. A lot of coaches, athletes, or therapists, they don't educate their clients or their therapists, their patients, and over the long run, nobody really get educated, and then they kind of lost. So in my business, in my practice, one of the most important thing for me, as you can see in my office, I have a lot of charts, I have a lot of models, just like you're behind. Just like behind you, I try to educate all my clients as much as I can, because the most important thing, see, that comes to again the Western, Eastern mind. Because if they don't know exactly which way we're walking in the progress, they're gonna get lost, and they will not gonna know what to ask for from their bodies. So because of that reason, yes, I do a lot of corrective exercise with my athletes. I try to educate them, just like today, for instance, I advise him to do some internal rotation with his hips. But he understands, he's a very knowledgeable athlete. So, similar to this kind of case, I give them some exercises, I explain them, and I correct the issue, and we go to next step pretty much. Thank you.
Thank you, brother. All right, I'm gonna go sleep now.